Good afternoon, everyone. I'm Miklós. I would like to present to you my PhD topic, which is the role of knee injuries in the development of osteoarthritis. My name is Miklós Máté. I'm a third-year resident at Uzsoki Street Hospital on the Department of Orthopedics and Traumatology. Let me introduce my vision and also my goal. Our department is one of Central Europe's leading cartilage repairment centers. So my goal and vision cannot be anything else but to go along with that road and also to develop ourselves and our center. Sports surgery is one of the fields we are making a very good progress in, especially anterior cruciate ligament reconstructions. And my mission is to help to give a tool which help decision making for daily practice, and to have a more clear picture about my topic, which is about post-traumatic osteoarthritis. As I already mentioned, my two ongoing projects are based on the ACL reconstructions, one meta-analysis and one prospective cohort study. On my meta-analysis, I would like to investigate short-term osteoarthritic evolution of knees with a comparison of surgical and conservative treatment. ACL reconstructions are one of the most common sporting injuries, which mainly affects young and healthy populations. In the US, almost 130,000 surgeries performed a year, and the prevalence of osteoarthritis in a 20 years follow-up study is 50 to 90% 10 years after ACL injury. These are the long-term effects, but actually on short term we could see MRI signs like cartilage thinning, bone marrow edema, and proteoglycan depletion based on fresh studies. And besides that, the superiority of surgical treatment compared to non-operative is low. Also, it is frequently cited that ACL rupture is an indication for reconstruction, but the relationship between reconstruction, rupture, and the progression of articular cartilage degenerative change is controversial. So my aim is to analyze short-term osteoarthritic evolutions with the ACL injured knees. Here you can see my PICO. Our population will be patients with ACL ruptures, and we are going to compare surgical and conservative treatment. And on the outcome, we are mainly focusing on the development of osteoarthritis based on the MRI findings, what I mentioned: bone bruising, bone marrow edema, bone marrow lesions, and cartilage defect. The clinical question is quite simple. Does surgical treatment decrease the incidence of post-traumatic osteoarthritis? Based on the present studies, we couldn't say an exact answer. So my clinical implication is to help decision making for the daily practice, and also is a really important thing to identify patients who are at high risk for developing osteoarthritis. We made a systematic search on 3 databases with this search key, and we found more than 2,500 articles, and from that we have chosen 21 which were eligible for our criteria. My second project will be a prospective cohorts analysis, what we would like to build up. It's also going to be an investigation for early signs of post-traumatic osteoarthritis, but we are going to see isolated ACL ruptured knees, and we are going to compare with the contralateral healthy one. As I already mentioned, mostly ACL rupture mostly affects young and healthy populations, and with isolated ACL injuries, only limited data existed. One of the MRI findings, what we are keen on to investigate is the subchondral edema or bone marrow lesions, which with a recent study demonstrated that more than 80% of the injured patients are present. Also, the outcome in the prevalence of osteoarthritis in short-term studies is highly variable based on Nakata and his co-workers, but also there is a controversiality in the literature. Some say that the initial bone bruise and chondral changes, the relationship between initial bone bruise and chondral changes are unknown, but some say that bone bruising is a significant risk factor for degenerative changes 2 years early after the injury. I would like to present to you, we had an own study before where we already used this protocol that we compared the injured and the contralateral healthy knees, and it was an X-ray trial. But we found a significant joint space narrowing despite the small amount of patients, which led us to go through with this MRI study. Here you can see our population is patients with isolated ACL ruptures, and we are going to compare the injured with the contralateral healthy ones, and we are going to see the progression with MRI. Our clinical implication is to understand these findings, these early osteoarthritic changes, what were not really investigated before. There are a lot of fresh studies which are getting to know these so-called MRI findings, what I already mentioned. Because of this controversiality, and also we have to see that all the studies had the methodological limitations. We would like to have a more precise group to investigate. And also we are keen on these outcomes, what we are trying to have. On that picture you can see how a bone marrow lesion or bone marrow edema looks like. Maybe we could build up a new grading system based on the extension of bone marrow edema, but it needs to have a lot of investigation more. So here we are now. You can see these are our plans for the submissions, and I put a quote from Confucius: "It doesn't matter how slowly you go, as long as you do not stop." We believe, actually, in the phase of this first part, I felt a lot this one, so we can stop. Thank you for your attention.
Well done, very interesting and beautiful presentation. First project. So you said there are 21 studies eligible for data extraction.
Yeah.
What study designs did you find? What are the study designs?
Well, which are comparing the surgical and the conservative treatments. There's a big registry in Sweden which were had. It's called the Canon study, and also not in Sweden. There is one in America, and these studies are focusing on a lot of aspects which are comparing surgical and non-surgical treatments, and one of the parts is the MRI findings, what hasn't got a big too much highlight on it. But we think and we believe that it's an important thing to identify the ongoing or the status of somebody has a future osteoarthritis. So,
have you found any randomized controlled trial
Well, yes, there were. This one what I mentioned, it was randomized. It was an RCT, part of them.
But not all of the 21.
Not all of them.
Okay, fantastic. And I was just wondering that those are very little changes to me. What should be described on the MR of these patients? Very little millimeter changes, and how can you, so that endpoint of diagnosis of if we go back to your one of the first slides on the first project, so that outcome, development of osteoarthritis in short-term MRI, is that hard enough, that endpoint, that outcome? Is that something which can be truly easily judged, or
Well, these are.
I feel it a little bit subjective.
Yeah. Okay, I understand. These are exact numbers. As you can see, my second project will be a lot. We would like to see the literature. How are these numbers, or how are these measurement tools are works? There are some scoring systems which are already existed, but these are findings what we think and we believe that if we are focusing on it could give us another point of view, another vision for these kind of injuries, and it could lead us to understand more of these kind of injuries. Not only these kind of injuries, actually cartilage injuries.
I have a question regarding your second project, eligibility criteria. So you were saying that you try to exclude a lot of other injuries for the injured knee or the contralateral knee as well?
Well, we need a contralateral healthy one. So, so it's 100%. We would see both knees by MRI. So for the anamnesis from the patient, we need a contralateral healthy one. But we see in our clinical practice that this kind of injury mainly affects young and healthy populations. So basically, there are a lot of patients who has a contralateral healthy one and a fresh isolated ACL ruptured.
But also previous injuries then are excluded.
Yeah, exactly.
Okay.
Exactly. We are in a protocol drafting phase, so yes, there is not everything wrote on that slide, but as I mentioned, because of that methodological limitations, we are trying to have a more precise and more standardized population group to have a clear answer for these kind of questions.
Thank you.
In your first study, when you have a surgery group and a conservative group, and then different research groups or different kind of centers, are these standardized so everybody understands that this, I mean, is there a standardized surgical procedure and nobody deviates of that? This may be even more important to ask about the conservative.
Well, this is another bias. Actually, our second project, we are going to perform the surgeries also. So, like, we are going to choose a patient who has the eligibility criteria, and after we are going to operate it. In our department, we mainly use transibial positioning and the same technique and hamstring grafting and. As I mentioned, the methodological limitations were like this, what you mentioned, that other surgeons, different surgical skills, different methods, different graft typing, but we do probably, or our plan is to do the same. So we have a really precise patient group, and I think we could collect a precise data from that. So after when we finished it, we don't want to write down that because of the methodological limitations, these are like in every articles we read about this. So this is how we try to achieve it.